it's really an honour to be here. I think this is a really important event and a really special event, and it's just lovely to be part of it. So I'm the CEO of Health Research Charities Ireland, so you can get a sense there of who is involved in that group. And you'll see the Alzheimer Society there, and in fact I can my whole career has been linked to this group in some way or other, because I used to work in a lab that was funded by Fighting Blindness, and then I went to work with the patient organisation Deborah Ireland, and now I'm with Health Research Charities Ireland. So Laura asked me to talk about designing research for practice. Okay, so what do we mean by that exactly? So what we're talking about is making a difference through research. We sometimes talk about societal benefit. And in the context of today, what we're talking about, of course, is impact for people living with dementia, their families and their carers. And you could rightly ask, you could rightly say, but surely research is always designed to deliver these things, to make a difference. And so there are various things that are changing and still need to change for that to happen. So if you think about how academia has been set up and the history of academia, the driving force was always publications, peer-reviewed publications, and they're really, really important. That's how scientists disseminate their work, and that's how they have others in their field, their peers, judge their work and ensure it's of good quality. The problem with it is, if there isn't a wider effort to take the findings from research and push them into society, they can just sit on shelves. And what we actually want to do looks more like this. And Andy set me up perfectly for this, with this link between the services, between the care and the research. So, what we want to do is research which leads to discovery, that brings about interventions for people living with dementia, and then the lived experience feeds back into the research. So in an example of what that looks like, when I was in Deborah Ireland, one of the things that we were doing was developing clinical practice guidelines. And we were using the findings that came out of research, bringing the people living with EB. Some of you may have seen Claudia on the Late Late Show on Friday night. She was amazing. Claudia lives with a very severe form of EB. So bringing people living with EB into the process as well, so they could talk about what was important in their lives, what was possible in their lives, taking these things together, developing clinical guidelines that would support care in the clinic, and then the experience feeding back into that lovely loop. So I'm going to run through 5 things there's so many things we need to do in this space, but I've put together 5 points that I think we need to think about as a broad community, because we all have a role to play in this one way or another. So the first one is about creating space for other types of expertise. And what do we mean by expertise? And, if you think about when we hear an expert on the radio, they often have the title doctor or professor. And in fact, the media actively seek out those people. And traditionally, the head of a lab, the PI, or maybe with some involvement of the postdocs, they decided what gets researched. And I say this with kindness to my former researcher self, because that's exactly how it was for me. When I was in a lab, I worked on a hereditary form of blindness called retinitis pigmentosa. And we spent years looking for a gene that caused this form of blindness. And every day, I got out 36 DNA samples out of the freezer, and I worked on them, and I knew a tiny little bit of detail about these people. They were a big family living in Spain, and I never met them. I never really knew anything about them. And when we eventually found that gene, but we were working on an area of a chromosome, and there were all these genes sitting in it, and we were methodically going through them all to see which was the one. And we passed over the one because it was used in the eye, expressed in the eye, but also in other parts of the body. And so we thought, well, if that was the one, there'd be other issues in the body. So we discarded that one and eventually came back and found it. But I often wonder, had we spoken to that family, would they maybe have said, oh, I know you think we just have this retinitis pigmentosa, but actually I've got these symptoms and these symptoms. It could have changed everything. And I know you in this community have many, many examples of PPI working well as well. So it's really about rethinking what we mean by expertise, and particularly bringing in that lived expertise, particularly the PPI piece, but all sorts of expertise. And leading into that then, I know I don't need to tell you here about PPI. You've got the Dementia Research Advisory Team. I've already met Kevin today and Susan and Janice and a few others. And you are doing an amazing group, and many others are looking to you. And the Irish Dementia Working Group as well. I know you've got years and years of experience in advocacy and in the research space. And so that's a really, really important part of the puzzle. And again, I know this is something you're thinking about in this community. It's, it tends to be the white middle class straight folk, and we're all working to overcome that and bring in more inclusion, more diversity, and be inclusive about that. So if, when we look at what's happened in terms of genomic studies, so the study of genetics, people's entire genetics, population, genomes, what we see is that studies from all over the world are largely based on people of European descent. So how much are we missing in that? And it's not just about race, it's also about the LGBTQ plus community, people with disabilities. So going back to what we're talking about impact from research. And if it's just going to be impactful for one portion of the population, then that's not as impactful as it could be. So we need to think about that early. Engaging with all stakeholders. So I've touched on this as well, already. So the people living with dementia, their families, their carers, and so on. The healthcare professionals piece, that's quite obvious to us as well. But what we need to see more of is when we're designing a study at the very start, who else should be in the room? So sometimes it's policymakers. If the intention of the study is to change policy, have you talked to the policymakers about that from the very start? And sometimes it's politicians as well. And it's really about thinking who needs to be involved in those early discussions so that the study is shaped in a way that it might actually lead to impact in the longer term. And then the fifth one, and relating to that a little bit, is about tailoring your message for different audiences. Okay, so I think one of the challenges with generating impact from research is that the research study finishes, the funding comes to an end. Whose responsibility is it then to take the outcomes and push them into care, or social care, clinical care, whatever it is? Who does that? And there's no easy answer to that, and it's partly about having those discussions with everybody at the very start and trying as much as we can to take responsibility for bringing it all the way through. But it's also about how we talk about the outcomes of research and tailoring those messages for different audiences. So, for example, the researchers published in peer-reviewed publications. That's really important. We need to talk to the public about it in a different way. So the public often, they like it to be engaging. They often like the outcomes to be associated with a story. Like, what did it actually mean? For policymakers, it's different. They like to see not too much information because they're very, very busy people, but they like to know what the evidence is and how they can draw on that evidence. And for politicians, it's different again. For politicians, again, you need a little bit of storytelling. They often want to know who's affected. Where are they? How can I help? What can I do? Can I change the legislation in some way? Or can I put pressure on the system in some way? And so it's just about being thoughtful about all of those things. When I look at ASI in this community, this is what I see. I see really strong and ever stronger PPI. Laura and Kira and Clodagh and others are doing an amazing job. And it's so, as I said, others are looking to what you're doing here. You're already thinking about the inclusion and diversity piece. I think that's a workshop with LGBT Ireland. And then you've got the advocacy piece. I was talking to Clodagh about that earlier, and Andy was talking about this as well. You're really placed to help with the impact because you've got that experience in advocacy. And also the research can feed your own activities as well as the broader needs. And then there's the communications piece. Laura, you did such an amazing job on Morning Ireland recently. It was so good. And what I was really struck by was the way you delivered that message. And it was, yes, this research is really exciting, but it was also really thoughtful about not giving false hope and staying grounded in reality. And I think that's what organisations like yours do so well. And I see all of that feeding into a very strong research strategy and this new funds that you've established to fund a research project where you're taking control from the start, thinking about the impact from the start so that it's something that is important to your communities of people. You're in good company. this is what we see in our member organisations. This is a survey we did last month, and these are the kind of things that they are all doing as well. And I think as a wider community, there's such incredible strength in that, in terms of the impact, societal benefit from research. And you see the PPI, the communication, and the connecting stakeholders, running research events, things like today are so important as well. Just for my last few slides, just to finish up and take a little step back and look at the broader context. I think we are in the middle of a culture shift. We're definitely in the middle of a culture shift around PPI. And also, I think, around thinking about research in a different way. And it's actually really a pleasure to kind of see this progress. And these are the wider things that happen. So we've got a new national research strategy for science and innovation, and it's called Impact 2030. And there's a very strong focus on societal benefit in there. The National Open Research Forum are doing interesting things about opening up research, because one of the problems with peer-reviewed publications is that they've been closed to us to a large extent for years and years. So the state funds research, or ASI funds research, and then can't access the research that they funded without paying a fee to do that. So there's this huge shift around opening it all up and opening up more sharing of data. If you've collected data, there's a kind of responsibility to the people you gathered that data from to use it in the best way possible, with their consent, of course. Just last week, the Department of Health ran an event, I think it was called Evidence for Policy, and I actually haven't seen them do something like that before, so they're thinking about it now as well. And within the HSE, there's a very strong team in there looking at research dissemination, knowledge translation, as they call it, and impact, and providing lots of guidance to researchers within the health service. The HRB are very much doing their part as well. This is them announcing their latest Impact Award. Mary was the first recipient of that Impact Award a few years ago, and they're also looking at researcher CVs and allowing researchers to tell the story of their impact a little bit more, not just their publications and the funding they got in, but a broader story. The PPI Ignite networks, and very close to my heart, ASI is involved as well. We're centrally involved in this, and that's about improving PPI nationally. And Campus Engage are doing that in a broader way around broader engaged research. So there's a lot happening in a wider sense. And just very quickly to tell you what we do ourselves in HRCI and Health Research Charities Ireland. So we have a PPI shared learning group, which ASI are kindly hosting in their offices tomorrow. Thank you, Ciara. We have various tools and resources around PPI to support charities, but more broadly as well. And as I said, we're involved in the National PPI Network. We have this joint funding scheme with the HRB, and Mary's going to talk about a project that was funded through that. Kevin has been very involved in that as well as a PPI reviewer, and did an amazing job. We run the Irish Health Research Forum, and this event that's pictured, that is our last one. It was actually on the theme of impact, because we know this conversation needs to happen, and for everybody to be having this conversation more broadly. We have launched our own Research Impact Award, and we announced that just in December, the first one of them. And then again, that's to focus minds on when charities, civil society organisations, when they fund research, they're only doing it for one reason, and that is that impact, that societal benefit piece. And so it's really focus minds on that. And then we do wider research advocacy, so just to make research stronger in general. So that's us at the Oireachtas Health Committee last month, talking about electronic health records. So what can you do? Because I really do believe that everybody has a role in thinking about this and pushing this forward. So I would say that we often see research and care or services as being kind of separate. And I think we need to, going back to that infinity loop, we need to recognise that they are part of a continuum. Even if you look at the HSE, it's very hard to do research within the HSE, even though we know it improves lives. I think we all need to be emphasising that they are part of the same thing. Always asking who else should be in the room. That diversity piece, but also who is ultimately going to be responsible for taking those research findings and pushing them through. And they need to be in the room from the very start. And just being intentional about all of this. Thinking about it from early on and all the way through and beyond the end of a grant. And so that's me. Thank you very much for listening. Thank you for the invitation, Laura. It's great to be here. you.